Ehlers-Danlos Syndrome is a connective tissue disease that occurs with a frequency of 1 in 5,000. Yet thousands of patients go undiagnosed and suffer with pain for years before a correct diagnosis is made. Let us follow one of these patients on their journey to diagnosis. Candice P. was a 26-year-old school teacher who was a strong believer in the virtues of healthy living and regular exercise. She believed that by living a healthy lifestyle, she could stave off the onset of chronic disease. When her friends ate carelessly or did not exercise, she frequently scolded them and urged them to pay closer attention to their health. As a school teacher, she was even more proactive and frequently reiterated the importance of healthy eating and regular exercise. Candice was in great shape and was slip and fit from years of active living and following a strict Mediterranean diet. She never ate red meat, never smoked, and took daily supplements with antioxidants. As she was growing up, she saw her grandmother suffer for all her life from chronic obesity and diabetes. When she was 14, her grandmother died from complications of diabetes at the early age of 64. She was very close to her grandmother, so the death affected her profoundly. She believed that had her grandmother followed a healthy diet and exercised regularly, she would still be here. Candice became very sad when her grandmother died and swore that she would do everything in her power to avoid developing obesity and diabetes. She enrolled in classes on healthy living and read books on healthy lifestyles. And the more she read, the more she was convinced that the secret of avoiding chronic disease was to stay fit and to eat a healthy diet. She became so obsessed with healthy living that she shunned anyone who did not exercise regularly or pay attention to their diet. As a child, Candice was a little clumsy and had fallen down the stairs leading up to the second floor of their home on several occasions. And she remembered being scolded frequently for dropping things. The family doctor had told her parents that this was normal while children were growing, because their rapid growth, along with the relatively weak muscles, threw their coordination off. As part of her healthy lifestyle, she exercised regularly, but from about the age of 20, she occasionally got joint pains after exercise. One day, while she was swimming in a friend's pool, she dislocated her shoulder without, as she put it, ever doing anything strenuous with the arm. The shoulder, as painful as it was, slipped back into place spontaneously just as she was preparing to go to the emergency room. Wanting to achieve an even higher level of physical fitness, she set herself a goal of running a marathon within the next year. She gave herself 1 full year to prepare for this life goal of hers. Her training went well for the first month. Then she started having pain in the knees and the hips while running. Soon the pain got so severe that she could only run half of a mile at a time. She cut back her training to quarter-mile stints intermingled with half-mile walks. The pain, however, only got worse. Because of the now increasingly severe joint pains, she paid her family doctor a visit, who told her that the pain was from overtraining and from overuse of her joints. He advised her to adopt a lighter training schedule. 1 month later, she was still having pain. With mounting frustration, she went to see an orthopedist who did blood work for rheumatological diseases and gave her ibuprofen for her pain. All the test results came back normal, and the x-rays of her joints were normal as well. The orthopedist diagnosed psychogenic pain and referred her to a psychiatrist. She underwent psychotherapy for 3 months, but Candice stopped therapy because she could see for herself that the pain was not in her head. Meanwhile, she was running out of time to train for the sporting event of her life. It was now only 6 months before the marathon, and she still could not train. She began searching online for a diagnosis for her symptoms, and one day, while browsing the internet, she saw an advertisement for a doctor who specialized in pain syndromes, and she made an appointment. As soon as the doctor saw her, he asked her to perform the Steinberg sign or thumb sign, in which the thumb extends beyond the palm when the fist is closed, and to perform the Walker-Murdoch sign or wrist sign, in which the thumb and the fifth finger overlap around the wrist. They were both positive, and she even showed the doctor how she could bend her thumb all the way back to touch her forearm. Now, Ehlers-Danlos Syndrome is a collection of connective tissue diseases in which the collagen in the extracellular matrix, the matrix that supports our cells in the body, is defective, leading to looseness of the joints and easily stretchable skin. Because of the lax joints and lax tendons, patients with Ehlers-Danlos suffer frequent dislocations and injury to their joints. Eventually, the joints degenerate, causing pain of varying degrees of severity. There are 14 subcategories of Ehlers-Danlos syndrome, 13 of which have been linked to specific genes. The 14th, or hypermobile Ehlers-Danlos, is inherited in an autosomal dominant fashion, but so far a specific gene has not been identified. For unknown reasons, hypermobile Ehlers-Danlos syndrome is more frequently diagnosed in women than in men. Now, patients with Ehlers-Danlos syndrome can suffer from diseases of the cardiovascular system, and Ehlers-Danlos syndrome has been associated with mitral valve prolapse, a condition in which the main valve in the heart malfunctions, and it's been associated with POTS, or postural orthostatic tachycardia syndrome, in which the heart rate rises abnormally when the patient stands up. It has also been associated with MCAS, or mast cell activation syndrome, and low blood pressure. They have poor wound healing, and this puts them at risk during surgery. Hypermobile Ehlers-Danlos syndrome is diagnosed by clinical examination, but a genetic diagnosis is preferred in all the other 13 subtypes. The doctor diagnosed Candice with Ehlers-Danlos syndrome and referred her to physical therapy, where she received muscle toning and joint stabilizing exercises. Through education and physical therapy, her pain decreased and she felt better. The pain, however, was not completely gone, and sadly, despite the improvement she experienced, she could never return to training. Her dream of ever running a marathon had to be abandoned, but her obsession with healthy living had paid off, and up to this day, she still has not developed obesity or diabetes. Today, she's an active member of a society that caters to the needs of people with Ehlers-Danlos syndrome. I hope you enjoyed the video and it made you more aware of Ehlers-Danlos syndrome. If you know of any patients that had similar experiences before a correct diagnosis was made, I'd be interested to hear about it in the comments below. Like, share, and don't forget to subscribe to the channel. Thank you for watching, and until the next video, stay healthy and stay safe.